Hi everyone, I'm Dr. Preeti Sharma and I'm an educator on the platform of Unacademy. So we've been carrying out a series every day at 3 p.m. in the afternoon where we talk about, different things and high yielding points of microbiology. Well, today we are going to discuss a mixed bag of questions for bacteriology. So I've planned that in the coming 2 to 3 days, at least 3 days, I plan to cover approximately 50 MCQs with images and mnemonics. It's going to be a complete mixed bag so that you have no bias of any sorts and we can touch upon all the important bacteria and PYQs that we have to. So guys, without a further delay, let's begin right away, and here you go with question number 1. So let's read. We've got a 40-year-old patient who presented with fever and a red painful boil on his lower hairline. The doctor sent, obviously there was a boil, so there was a pus sample which was sent and which on gram stain showed violet color. I hope you know violet color means gram positive. Grape-like clusters. Now, what are they talking about? When they talk about grape-like clusters, well, this is the thing. So, violet color grape-like clusters, I think you know we are talking about Staph aureus, and they want to know what is the virulence of the causative organism due to. So, which of these enzymes is produced by Staph aureus? We all know we have coagulase, right? So, my quick revision is going to be that when I'm talking about Staphylococcus, what are the different enzymes that it produces? Well, so number one, if I pick up the alphabets from Staphylococcus, that is what I'm going to do. So I've picked up T, PH and CC. T for thermonuclease. Nuclease will remind me of DNA, so DNase. So thermonuclease, DNase. Then PH reminds me of phosphatase. So that is what I take up next. And then we have C and C, which reminds me of catalase as well as coagulase. So yes, these are the two things that I have to know. The first, catalase, coagulase, phosphatase, thermonuclease, DNase. Now every day guys, I'm going to give you a homework, and this time in bacteriology, our homework will be such which will help myself and which will help all the other students around me. That should be your aim. Every day I'll give you one or two lists to mug up. So today's list is, all of you are going to, there's a mnemonic for catalase positive organisms. Today you're going to type that out in the comment section. Help yourself by typing you will learn, by reading your friends will learn, and tomorrow before I start with the session, I'll be discussing that catalase positive list with you all. So every day you tell me one list, next day I revise that list again, add something that needs to be added, then give you another two more lists to make. So every day once we keep revising those lists till the exam for another week, I think we are good to go, we'll be sorted, right? So catalase or capsulated organisms, urease positive, oxidase positive. So we'll try in the next 4-5 days we finish off all these lists. So what is your homework for the day? Catalase positive organisms. So well, the virulence factor is done. Let's move on to the next question. So now you need to tell me which of the following organisms does not show the test which is below. So if I quickly read, I see two test tubes over here. One of them is labeled as positive, one of them is labeled as negative, and all the options that are given to me are Staphylococcus. So that means I'm talking about some test of Staphylococcus which occurs in a tube, and that is known as the tube coagulase test. I hope all of you know that coagulase tests is of two types. One is known as the tube coagulase test, and this tube coagulase test is also known as the free coagulase test. So how did I learn this? Tube has 1, 2, 3, 4. Tube has 4 alphabets. Free also has 4 alphabets. So tube and free are the same. If you read over here carefully, slide and bound. If you see carefully, slide has 5 alphabets, bound has 5 alphabets, so slide and bound coagulase is again the same. Let me tell you that Staph aureus, intermedius, hicus, they show you both. There should not be any confusion. All of these show you both type of coagulase tests, but Staph Schliefferi. See, ferry sounds like a free, right? So which coagulase test does it show? The free. So which is the free one? The tube or the slide? 4 alphabets. So free becomes tube. Talking about lugdunensis. Lugdunensis sounds like dunensis sounds like bound. Okay, so lugdunensis shows you bound, and bound is 5 alphabets. So we have slide coagulase test. Let me show you pictures. Over here you see the first one which is being carried out on a slide. So that's a slide coagulase test. The second one is on a tube. So that's the tube coagulase test. That's another picture of the tube coagulase test. And now I can come back to my question. So first, I was told that which are the ones which have both tube and slide. So Aureus, Intermedius, Hycus. Aureus also shows me both. Hycus also shows me both. Intermedius is not there in the question. Then I said Schliefferi. Schliefferi reminds me of free coagulase. 4 alphabets means tube coagulase. So this also shows me tube coagulase. Which does not show me is Staphylococcus lugdunensis, because lugdunensis reminds me of bound coagulase. Bound coagulase test is the 5 alphabet slide coagulase test. So what's the answer to this question? Staphylococcus lugdunensis. Coming to the next, as per the images shown below, which of the following does not correlate with the culture characteristics of Staphylococcus aureus? So we've got option number A, option number B, C and D. Which of them is not Staph aureus? So if I pick up each one of these, I think everyone can appreciate this is a beautiful blood agar, because it has blood in the background. This is transparent, so this might be a nutrient agar. This is a kind of red, kind of yellow turned. Let me tell you, this is a mannitol salt agar. And this again is a blood agar. So basically, I've got two blood agars over here. In one of them, if I look very carefully, I see that okay, there is clearing, but very, very narrow. There is a narrow zone of hemolysis. Over here, the amount of clearing is a lot. There is a wide zone of hemolysis. So first I want to tell you that when we are dealing with a wide zone of hemolysis, wide zone of blood is being broken down, I am not talking about Staph aureus, I am talking about Streptococcus Pyogenes. So I've always told you a mnemonic that when I'm dealing with Streptococcus Pyogenes, everything, and I'll be teaching you this again shortly, pi, y. So everything, if I ask you what's the medium, you'll say Pike's medium. So pi. If I ask you what kind of a hemolysis, narrow or wide, you'll say pi, y. So it's a wide zone of hemolysis. So Streptococcus Pyogenes shows me wide zone of hemolysis. Staph aureus on the other hand, in the first image that we have, Staph aureus shows me a narrow zone. So why not, guys, do something? Why not quickly see all the culture and important pictures of Staph aureus? If you remember, I gave this to you as an IOTD a couple of days back. So the first thing, you see these violet color grape of cluster of grapes, bunch of grapes. So they are gram positive bunch of grapes. That is why you call it staphyle. So what do you mean by staphyle? It's a bunch of grapes. You call it coccus. Bilkul. It is a round. It is round. It is like a coccus. What else do you call it? You call it Staphylococcus aureus. What do you mean by aureus? Aureus means golden yellow. So can you all appreciate that there is a golden yellow pigment that is formed on nutrient agar? And this pigment is staphyloxanthin or beta carotene. It's a beta carotene pigment given a fancy name, that is staphyloxanthin. It is goldenish in color because the word aureus means golden. What kind of hemolysis will you see? Narrow or wide? I hope you know we see narrow zone of hemolysis. What is the selective media? Now that's a very interesting question. What is a selective media that you have for Staphylococcus aureus? And that selective media is MSA, mannitol salt agar. So before I start teaching you, I want you to answer this question about it. If I ask you mannitol salt agar is which type of an agar, selective, differential, both or none, I think all of you are going to say selective, I just taught you, but actually it is both. I'll tell you exactly how. But first tell me what's the indicator of mannitol salt agar. The indicator is going to be phenol red. So now let's study about MSA. Let's study about mannitol salt agar. Mannitol salt agar. So first and foremost, the salt is what makes it selective. The salt in it makes it selective because the salt allows only, selective is something which will selectively allow something to grow. So the salt only allows staph to grow. What makes it differential? Mannitol makes it differential because it differentiates. Is the organism mannitol fermentation is happening or mannitol fermentation is not happening? So let me tell you, Staph aureus is definitely a mannitol fermenter. Can you see the color has changed to golden yellow? Everything in it is golden yellow, right? Pigment was also golden yellow. The color that mannitol fermentation gives is also yellow. Whereas In all the other staph, epidermidis or in Micrococcus, mannitol fermentation is not seen, so the color remains the same. What is the same color? The same color is red. This means what was the indicator that was used in this medium? The indicator that was used was a phenol red. So repeating for all of you, mannitol, salt, agar. Mannitol makes it differential, it differentiates. Salt makes it selective, so it's a selective medium. Mannitol fermentation gives a yellow color. So now when I come back, I think number 1, narrow zone of hemolysis is Staphylococcus. Golden yellow pigment is Staphylococcus. Here you see that this part is not a mannitol fermenting organism. This part is a mannitol fermenting organism because yellow color. So all 3 of these are related to Staph aureus. But when I see a wide zone of hemolysis, that is Pyogenes. Okay, having done with this question as well, now let's move on to the next. Which of the following below is incorrectly matched? So if I read through quickly, I've got you options of staph and Micrococcus. So you have to tell me which of these is incorrectly matched, which shows a fermentative pattern and which shows a oxidative pattern. So first what I'm going to do is I'm going to read. So when I say Staphylococcus, everyone knows it means a bunch of grapes. Staphylococcus, the arrangement is going to be a bunch of grapes. When I go in for Micrococcus, it's a tetrad. 1, 2, 3, 4. Micrococcus is going to be arranged like a tetrad. How do they utilize glucose? Fermentative pattern or oxidative pattern? So remember, Staphylococcus sounds like F, Staphylococcus. So it utilizes glucose in a fermentative pattern. Micrococcus has a lot of O's, so it utilizes glucose in an oxidative pattern. Remember, so which of them has a fermentative response? Staphylococcus fermentative reaction. Which of them has an oxidative reaction? That is Micrococcus. Catalase positive, both, so that doesn't differentiate. But oxidase positive, again, Micrococcus was all the things to do with O, right? So oxidase positive is Micrococcus. Having said that, now let's come back to this question that we have. So first and foremost, I think there's something gotten copy pasted. We just ignore that, some error probably in the formatting. Now tell me which of the following is incorrectly matched. So Staphylococcus, Staphylo fermentative pattern is sounding right. Coming to the next, Micrococcus fermentative pattern is not sounding right. Let me read everything. Staphylococcus oxidase negative, sounding right. And Micrococcus oxidase having the O, oxidase positive, sounding right. So clearly the answer to the question is Micrococcus fermentative pattern. That's incorrect. Now one question for you guys, that when I have to search for this fermentative versus oxidative pattern on glucose utilization, what is the medium that I use for this OF testing? I use the Hugh and Leifson's medium. The Hugh and Leifson's medium is done to know the oxidative fermentative pattern. Well, having said that, now let's do a complete switch in our questions and let's go in for this. Which of the following streptococcal antigens cross-react with synovial fluid? So think, what does our synovial fluid have? I think it's a really easy question. Our synovial fluid has hyaluronic acid. So the hyaluronic acid of the streptococcus cross-reacts with the synovial, and that's the answer that we have. So guys, when now we moved on to streptococcus. So when I'm talking about streptococcus, you know that first and foremost it has the C antigen, and C antigen is really important because I'm going to tell you about a classification. But C antigen cross reacts with the cardiac valves of the humans. Similarly, there's a membrane protein called M protein, and that cross reacts with the heart or the myocardium. So repeating, C antigen with cardiac valves, M antigen or M protein with the myocardium. So yes, there's going to be a cross reaction. If I continue from the same way, if I ask you, what part of the capsule cross reacts with synovial fluid, you will say hyaluronic acid will cross react. Okay, coming to the next. So now if I put up this question in front of all of you and I say there is a patient who presented with complaints of redness, sore throat, cough, hoarseness, redness of eyes. So lots of symptoms. I think possibly everything on this planet has been mentioned. Sore throat, cough, hoarseness, redness of eyes. Condition was diagnosed as a pharyngitis. Obviously, we know pharyngitis commonly caused by streptococcal pyogenes. Now they say that this C antigen or the C carbohydrate in streptococcal pyogenes is responsible for what? So is there any classification? Yes, the classification is the Lancefield classification. So first and foremost, what classification am I talking about? So guys, that is for streptococcus. On the basis of hemolysis, streptococcus is alpha hemolytic, beta hemolytic, and gamma hemolytic. What do I mean by alpha, beta, and gamma hemolytic? Let me first explain that to you. Alpha hemolytic is something which means partial hemolysis, beta means bilkul, complete hemolysis, gamma means no hemolysis. So first forget the gamma. It is not going to cause any hemolysis, no hemolysis, Enterococcus comes under it. Remember Enterococcus, no hemolysis, gamma. Alpha is partial, beta is bilkul. Bilkul ho gaya means complete. So alpha hemolysis gives a green color, beta hemolysis gives a yellow color. How will I learn? So the way you write alpha versus the way you write beta. So the way you write alpha, you can easily fit a G inside it. Okay, so we can easily fit one G inside it. It gives a green color. The way we write beta, we can put a Y next to it. It gives a yellow color. So let me show you an image which I think will give you better clarity. So first and foremost, over here you see you have an organism but there is no hemolysis. So that is gamma hemolysis. Blood is not breaking. Here blood is breaking partially, partial hemolysis, and I'm getting a green color. So yes, this is alpha. So like I told you, the way you write alpha is the way you are going to write a green. And then when you see over here, this is beta hemolysis. Beta hemolysis means yellow color. You can see the yellow color over here. Out of these, what comes under alpha? Under alpha, we have viridins and pneumoniae. The beta one is further classified on the basis of the Lancefield classification, and that is what they asked you. That the question was that the C carbohydrate in the Streptococcus pyogenes is responsible for what? Lancefield classification. So first and foremost, the beta category undergoes Lancefield classification, and Lancefield classification is based on the carbohydrate antigen, which divides it into 20 groups, A to V, simple alphabetical chain A to V, but that makes it 22 alphabets. So no I and no J. Repeating, Lancefield classification basis carbohydrate antigen. How many groups? 20. A to V. So group A, in fact, the one that I told you, Streptococcus pyogenes, the Streptococcus pyogenes, I'm actually going to ask you this, that which group does it fall under? Is it a group A, beta hemolytic Streptococcus? Yes, so Streptococcus pyogenes is a group A beta hemolytic Streptococcus. Now you know the group is based on Lancefield classification. So only if I take this group A, now I'm only focusing on this group A, it can further be having a Griffith typing and an M typing. So remember, under the beta hemolytic Streptococcus, you did the Lancefield classification. After doing the Lancefield classification, you did A to V. I've taken A out of it. I'm doing Griffith typing and M typing, EMM typing. Griffith typing is on the basis of the M protein. I just taught you what is the M protein, right? And next one is the EMM typing, which is based on the gene for the M protein. So one of the typings is based on the protein, one of the typings is based on the gene for the M protein. So remember, Griffith is based on M protein, EMM is based on the gene. Now having done this, let us assess the next question, which is this. So numbering has probably just been auto-formatted in some way. We are probably on some 5th or 6th question. But tell me each of the following statements about the classification of Streptococcus is correct except. Quite a multi-layered question, so it will take you time, guys. Streptococcus pneumoniae are alpha hemolytic, right? So I'll keep analyzing every statement. Streptococcus pneumoniae, yes, under alpha hemolytic we have Streptococcus pneumoniae and we have Streptococcus viridins. So that's right up till now. Can be serotyped on the basis of, so pneumonia is alpha hemolytic, right? It can be serotyped on the basis of polysaccharide capsule, correct? Pneumonia has a capsule, polysaccharide capsule. Next, Enterococci are group D streptococci. Maybe you say I've never read about it, and can be classified on their ability to grow on 6.5 NaCl. I'm going to teach you this is also true. Viridins streptococci. As soon as I say viridins, viridins is which category? So I just did pneumococcus and viridins are alpha hemolytic category. They are classified by Lancefield grouping, not at all. This is the wrong statement over here. This is the wrong statement over here because the Lancefield classification is for the beta hemolytic group and viridins happens to be the alpha hemolytic group. So I don't have to read the last option, but I'll be teaching you the last option. So basically, I'll be able to complete this question once I've read about Enterococcus and once I've read about this pneumococcus and this viridins. So quickly, if I have to differentiate between the alpha hemolytic category, we've got the viridins group and the pneumococcus group. Remember, viridins group is optochin resistant and bile insoluble. So if they ask you, viridins is optochin Ri, so R resistant, and bile I insoluble. Pneumococcus becomes opposite. Viridins is optochin, I'll repeat, viridins is optochin resistant, so this is optochin sensitive. Viridins is bile insoluble, so pneumococcus is bile soluble. So alpha hemolytic is done. And pneumococcus, I hope you remember, pneumococcus has a capsule, a very famous capsule on the basis of which it is classified. And do you all remember the capsule gives you positive reaction for what? Quelling reaction. So if this is the organism and this is the capsule that it has, obviously the capsule is going to have an antigen. That's obvious, right? If to that I add any anti-capsular serum, so it will be more like an antigen-antibody reaction. If I add any anti-capsular serum, do you agree swelling of the capsule will occur? Because capsule had an antigen, I have put a serum, anti-capsular serum. Quelling reaction is the swelling of the capsule. So quelling is swelling of the capsule. Please remember. So coming back, this was one part about difference between viridins and pneumococcus. So if I come back to my question now and I start analyzing it again, so is streptococcus, so I'll delete everything, I'll again start analysis. Streptococcus pneumonia alpha hemolytic, true statement. Can be serotyped on polysaccharide capsule, absolutely true. Look at the last statement. Although pneumococci and viridins, streptococci are alpha hemolytic, correct. They can be differentiated by bile solubility and optochin sensitivity, correct. If you remember, viridins, bile resistant, optochin resistant, bile insoluble. Optochin resistant and bile insoluble. And pneumococcus is opposite. So this is right up till now. Now I'm left with my study on Enterococcus. Then I'll be able to complete this question. So before I jump on to that Enterococcus, probably I can ask you a question and then go on to this. So please answer this for me. Which of the following is true about Streptococcus? That pneumococcus is bile resistant. So as soon as this question comes, the first thing should be, you should say pneumococcus versus viridins. You should say pneumococcus versus viridins. Immediately write, it is optochin resistant and bile insoluble. So this becomes optochin sensitive and bile soluble. Opposite. Now let's start reading. So pneumococcus is bile resistant. So pneumococcus, I say it is bile soluble. Okay. Pneumococcus is bile soluble. Okay, this could be a true statement, I suppose. Enterococcus is bile resistant. So suddenly you're like, ma'am, I don't know about Enterococcus as of now. Enterococcus is bile soluble. Enterococcus is PYR positive. So what are my right statements? Now I have to pick up. So the right answer over here is 2, 3, 5. 2, 3 and 5 are right. But for that I'll have to read Enterococcus. And what do you understand by Enterococcus? Is going to be this. So remember, the way you write Enterococcus, I'm going to pick up the word entero. So what is with E? With E, I've converted it into E like this. So it looks like a spectacle, right? It looks like a spectacle. So it is a spectacle shaped organism. Number 2, After this, we have N. N for no motility. It was gamma hemolysis, means no hemolysis, and can grow in NaCl 6.5. So what is with N? No motility, no hemolysis, NaCl 5, good to go. Even good to go with heat. It is tolerant to heat. Next, what is with E? Again, this E I'm going to change. I'm going to change this E into a B, and now this time I'll say it can grow in 40% bile. For that matter, you know the agar that we use is bile esculin azide agar. The agar that we use is bile esculin azide agar. So it grows in a medium with bile and gives black colonies. I'll show you a picture. It grows in a medium with bile, and see, this is BEA test positive, black color, BEA test negative. So B means bile, 40% bile it can tolerate. Having said that, what is R and O? There is a reaction which is going to come out to be positive, and that reaction is PYR test positive. It is PYR test positive. So quick revision, a very rapid revision that we have over here. So first E that you have is spectacle shape. N for no motility, no hemolysis, NaCl 6.5. T for tolerant to heat. E becomes a B, so BEA agar, black color, and reaction is positive. PYR test positive. So if I give you a question which looks like this. 73-year-old Ramlal has an intra-abdominal abscess, which is a very common thing to do with actually Enterococcus. The causative organism was found to be vancomycin, gentamicin and ampicillin resistant. So good amount of resistance it is showing. It can grow well in the presence of 6.5% NaCl, and bile esculin hydrolysis is positive. So NaCl 6.5%, bile esculin hydrolysis is positive. What are we dealing with? We are dealing with Enterococcus faecalis. One more question. Here you've got a 50-year-old patient underwent surgery for peritonitis. The patient started developing a wound around that area on the day of the surgery. Gram staining of the wound sample showed numerous pus cells and gram-positive cocci. On culture, it showed black color colonies. Now, black color colonies means which culture must have been there? Bile esculin azide agar, with something to do with a peritonitis and a surgical wound. And obviously, we are again dealing with Enterococcus faecalis. So well guys, that finishes this off, and I can come back to that question which I had pending up till now, which was this. Enterococcus are group D streptococci and can be classified on their ability to grow on 6.5% NaCl. That was also right. So clearly the incorrect statement that they had asked you over here was C, and now I've proven all the statements. I hope that is done with everyone. Well, we have another question which I'll quickly take you through, and this is what we have. So sorry for the numbering for the day because there's been a major glitch, some technical probably error. Which of the following best differentiates gonococcus from meningococcus? So I'm talking about Neisseria gonorrhoeae versus Neisseria meningitidis. First and foremost, up till now, whatever I've spoken about today were gram-positive cocci, staph, strepto. So basically, all the cocci are gram-positive. Except all the cocci are gram-positive except, well, you have this in front of you. You have Moraxella. Number 2, we have Velonella. And we have Neisseria. So Neisseria, Moraxella and Velonella. These are the exceptions, because otherwise all the cocci are supposed to be gram positive, but this one, these cocci are gram negative. So Moraxella, Velonella and Neisseria. Okay, well, having said that, now let's move forward. How to differentiate gonococcus from meningococcus? What is the best reaction over here? The best reaction is going to be maltose fermentation. So what do I mean by that? Very simple way. How do you write Neisseria meningitidis versus gonorrhoeae? Meningitidis causes meningitis, obviously. Gonorrhea causes genital infection. Now, meningitidis has both M and G. So, what will it ferment? Maltose, glucose, or both? You will say it will ferment maltose as well as glucose. Gonorrhea has only a G, so it will ferment only glucose. So, obviously, glucose is fermented by both. Only maltose is the one which differentiates. So, what helps in differentiation? maltose fermentation helps in differentiation, because maltose fermentation is only in Meningitidis, not in gonorrhea. Glucose fermentation is in both. So repeating, Meningitidis has M and G, so maltose and glucose. Gonorrhea has only G, so only glucose fermentation. Well, having said that, we'll stop the session right now. Tomorrow we have a few more Neisseria questions regarding their cultures. Thereafter, we'll have, spore-forming organisms, Bacillus and Clostridium, and even Corynebacteria questions. So I've told you the topics at least partly for tomorrow. So yes, that is what we take up tomorrow. Day after, I'll try to take up the tougher tables like Spirochetes and Rickettsia. I know those are also giving you guys couple of, problematic questions, but never mind, we'll have them sorted. Well, I hope the speed and everything is okay, because this is not for the foundation batch students, this is for exam going students, and I hope you're benefiting from it. Tomorrow we meet again, same time, 3 p.m., and we take up the other questions. Homework for the day was catalase positive organisms, and now also I hope you are following the 10 p.m. series. 10 p.m. image of the day, that is something you have to follow. Also guys, a major update is that now the Kickstart morning sessions for this week till your exam, they've become Kickstart evening sessions, because now they are conducted on the app at 9 p.m. So I've labeled it as prime time at 9. Okay, I've labeled it as prime time at 9 because, there were certain connectivity issues in the morning and we are exam going. I didn't want to waste up on too much of time. So for the time being, temporarily, this has been shifted to 9 p.m. and then we can obviously have further suggestions and discussions later on. Thanks a ton for joining in. Have a great day. Study well. Do not be panicky about microbiology. We will together find a way of making it simpler. Just keep going with the pace, keep going with the flow, and you will crack it easily. Okay guys, have a great day. See you tomorrow, same time with the same series.